At one point, 90% of South Korea's COVID-19 cases were concentrated in Daegu. Now the city has seen the number of new infections drop to zero, recovery rate at nearly 90%. Kyung-eun sheds light on how Daegu managed to get the outbreak under control.
The COVID-19 situation here in Daegu is under control, at least for now. And remarkably, the city has managed to get to this stage without imposing a lockdown. The city government attributes that to three key factors: social distancing, isolation of patients, and their treatment. The most critical pillar, it says, is the first one, people's active participation in social distancing, which began weeks earlier here in Daegu than in other parts of the country. A recent survey reported that about 88% of locals said that they had actively participated in what the city calls the March 28 movement. And the city mayor Kwon Young-jin says that's what differentiates Daegu from other parts of the world that have been hit hard by the virus.
Daegu has not imposed any aggressive legislative measures, nor imposed a travel ban. It was rather the public's collective, voluntary participation that helped stabilize the situation.
The second factor, the isolation of patients, came about in the wake of an exponential surge in cases in the city about 2 months ago, mostly linked to the Shincheonji religious group. That's when the city's medical system was on the verge of collapse. But the city prevented it from happening by introducing the so-called temporary care center system, which was used to house patients with mild symptoms so more hospital beds could be kept for severe patients. This quarantine system helped the city reduce the total damage from the outbreak and became an innovative model for other countries. And by April 30th, all 15 centers had closed after releasing all their patients. Lastly, medical staff who've come from all parts of the country played a critical role, as did the support and medical resources from the central government. The Daegu city government is planning to publish the lessons it has learned from the COVID-19 outbreak after it completely ends. Kyung-eun, Arirang News, Daegu.